everybody. Welcome to this UW Medicine Visioning session for a new UW Sustainability Action Plan. We are thrilled to have you here this afternoon, so thank you so much for making time for this. Before we get started, we're going to do just a quick introduction of our UW Sustainability team, and then we've got a fun little quick exercise just to see who's in the session with us today. So next slide, please, Lauren. So I wanted to just introduce our UW sustainability team. You'll see all of these folks in the rooms, the virtual rooms and breakout rooms later today. I'm Lisa DeLude. I'm the director of UW Sustainability. You can see our team here, Danny, Damon, Marilyn, Lauren, Emily, and we've got a fantastic group of interns. And our role at UW is really to serve as a connector, a bridge across the tri-campus and across the university to really scale up and amplify sustainability efforts. We also happen to be the entity that sort of leads the development of the Sustainability Action Plan, which is why we're here today. And I'll talk a little bit more about that in a minute. I also want to introduce Alyssa and Grace from our consultant team. They are from GlueMac, and they're big partners working with us across the next 18 months as we develop a new sustainability action plan. So Grace and Alyssa, thank you for being here. Okay, next slide, please, Lauren. So we want to figure out who's in the room here today. So go ahead and scan that QR code. And I think Lauren's also putting a link in the chat that you can click on it as well, because we want to know a little bit more about you before we get going.
Thanks, Lisa. Yeah, give me a moment. I'll put the link in the chat as well. This is just a Mentimeter if anyone's ever used it. It's a tool that you can kind of congregate everyone's answers in one place to specific questions. So putting it in the chat now, and I'll share my screen so we can see live updates. And the first question will be, what part of the UW Medicine Network do you represent? So I'm curious to see, how many faculty, staff, physicians, nurses, potentially students are here with us today. We were able to get pretty broad outreach, and I was really excited to see the registration list grow. So again, yeah, thanks to everyone who made time for this. I know there's lots going on this time of year, but we're happy you're here and sharing your insights with us. I'm going to go to the next question. Is sustainability a key part of your current role or academic pursuit? Lots of yeses so far. These questions will help us not only gauge kind of where folks are coming from, their roles, but also a better understanding of how sustainability plays a part in everyone's day-to-day. Oh, and I'm realizing I'm still sharing now it should be updated. Thanks, Damon. This is a great breakdown though. So thanks for sharing, everyone. I'm going to hand it back to Lisa to just walk through our agenda, and we'll get going with the meeting. But thanks for this little get to know you activity participating. Lisa, I'll share my screen with the slides and I'll hand it back to you. Takes me a moment.
I will say too on this question, no matter whether you're a sustainability expert or been involved in it before, or whether this is brand new to you, you don't have to be an expert of any kind to participate in this process. So wherever you're at is great, really and truly.
And Lisa, just one sec. I want to put up on screen, since I wasn't.
Oh, the first question. Yeah.
Yeah, just the first question. Let me reshare that so everyone can see it. So I'll scroll. This is great. And we are going to be collecting and kind of analyzing a lot of this going forward as we're documenting what we hear today. And so when we post the outcomes of this meeting, we'll be sure to also post a bit about who was here.
Yeah,
All right,
great.
I'll go back.
Okay. Yeah, thanks everybody. It's helpful for our outreach to know who we've actually had touch points with and gotten input from, and who we still need to do, where we still need to do some more work. Okay, so I wanted to just quick go over the agenda. So that was our welcome and warm up. So we're already generally through that. We're going to take a little bit of time to just give a really brief context of the Sustainability Action Plan, what it looks like today and how it originated, and then what does the process look like for updating it, sort of a high-level overview of the process. I'll go through that, and then I'll hand it over to Juan Escalante to give a brief overview of some of the sustainability initiatives that UW Medicine is working on already. And then after that, we're going to really get into the exciting and fun part of the visioning session today, which is the visioning itself. So we'll spend about 15 minutes doing some individual visioning, really thinking about what sustainability looks like today in your day-to-day, and what's possible, what do we want to strive for in 2050? So taking a long look out to the future. And from there, we'll then break into individual sort of breakout groups. And I'll give you more information on this. And we've done a couple of these visioning sessions already at the Seattle campus and with some other groups. And a lot of people say that 4 and 5 are actually the exercises they had the most fun with and really sort of energized and excited them. And then we'll do a quick wrap up and next steps. So that is our agenda for today. And Lauren, if you want to move into the next couple of slides, great. So we're not going to spend a ton of time talking about the current Sustainability Action Plan, but I think it's important to get everyone's brains warmed up for the discussion in a little bit about what the current Sustainability Action Plan looks like today. So UW's first Sustainability Action Plan was passed in 2020 and actually got approved. Oh, if you could go back to the previous slide, please. There we go, thanks. Was approved and published in 2020. It was the first Sustainability Action Plan for the organization. We'd never had one before. And then the pandemic hit, which wasn't great timing for a brand new strategic plan and trying to keep folks engaged. But the overall structure of the plan is that we have 10 measurable targets. I'll run through them really quickly here. Oh, this
I'm
is
sorry, it has a
that's
mind of
okay.
its own.
I think it's one of those ghost features. This has happened before where it just advances, the slides advanced on their own. So the 10 targets, the first is double student, staff, and faculty sustainability engagement by 2024. The second is create a one UW sustainability framework. The third is to double sustainability-oriented research projects by 2025. The fifth is to create comprehensive equitable purchasing targets. The fifth is 5% lower emissions from professional travel by 2025. The sixth is 35% of food is from local sources by 2025. The next one, the seventh, is 6% decrease in single occupancy commute rate per campus by 2028. The next one is 15% lower energy use intensity by 2025. The ninth is 10% less solid waste. And the 10th is 45% reduction of emissions by 2030. And you can see that we have some grounding principles there on the right-hand side of the screen. And this plan was created through a community-wide process, similar to what we're doing this round, but this round of updates to the Sustainability Action Plan is considerably more robust. And part of the reason, or a few of the reasons that we're updating it, is that this plan is scheduled to be updated on a 5-year cycle, and it's 2025, so we're at that mark. The other thing I want to highlight is just that there's a lot of great work and I think a lot of great elements to this plan, but we recognize that a lot has changed since it was created and since 2020, and there's a lot of room for improvement. So we want to build on this foundation, but this really is a fresh start as we go through this SAP update process. Okay, next slide, please. Hopefully the ghost doesn't keep appearing to advance the slides on its own. You can take a more in-depth look on our website at the Sustainability Action Plan. We also provide annual progress reports on how the university is doing in meeting those 10 targets. And those 10 targets are described in more detail in the plan itself. So there's specific strategies and actions under each of those 10 targets. But what our team and others who we work with have outlined in terms of areas of opportunity for a new plan is to really make sure that our goals and targets, when we set them, are informed by data and best available science. I think to some extent, some of the existing targets do that, but there's some are a little more squishy, and I think really need to have that data and science driver behind them. We also want them to be bold and reflect urgency. The current fires in California are a very real reminder of the need to act with urgency and align with climate science from our experts. We also want to address some gaps in scope in the current plan. So in those 10 targets that I just showed you, you'll notice that there is no target. The plan does not address water conservation as one example. We really don't address solid waste in a holistic way or sort of single-use products, particularly single-use plastics. And I think that's a very important element that could be integrated into the new plan. That goes hand in hand with sustainable purchasing. I think we know there's tons of opportunity in the healthcare system in particular for purchasing opportunities. Green building, climate adaptation, and resiliency. These are just a few topical area gaps that our team noticed that we'd like to address in the next iteration of the plan. The other piece I want to highlight, that sort of third line there, is to be more inclusive of the tri-campus and really be better integrated with medicine, athletics, housing, and food services. So the existing plan does an okay job, I think, of doing that, but medicine was really not included in a deliberate way in the previous iteration of the plan, and this is our way to change that, our course correction, so to speak. And medicine is such a integral and important part of UW, and we want to make sure that we're doing it right this go around. And lastly, the strategies and actions that fall under those 10 targets in the current plan do not identify policy or financing needs. What do we actually need to request or find in terms of capital or operating budget to make some of these things happen? And we need to know what sort of the rough order of magnitude cost is and have that embedded in the plan so we're better prepared to implement things. So that's a quick overview of the areas of opportunity. Next slide, please, Lauren. So goals, real high-level goals for the new iteration of the Sustainability Action Plan is we want to establish a clear 2050 vision. So that's part of what we're going to work on today with you all is what do you really want to see? What does success look like for UW Medicine in 2050? And that can be the North Star that we're working towards. I already mentioned that we want to make sure the plan is driven by data and climate science where it's appropriate to do so. We want to address those topical area gaps that I mentioned. We also want to share stories and perspectives from our UW community. So that's a part of the plan that I'm going to talk a little bit more about later. But we think that storytelling can be a very powerful tool to motivate and inspire others. That could be other students that are going to be here in 5 years starting as freshmen, and they can read about your story as a nurse, as a healthcare professional, as a med student, and really be inspired to get engaged and help us implement the plan down the road. And then lastly, again, identifying those funding and resource needs to meet our goals. So those are some of the big big ticket items we have in terms of organization of the plan and plan outputs. Okay, next slide, please. So Marilyn on our team has created this slide, and I think it's a really nice high-level overview of what the planning process is for getting this strategic plan completed. So right now we're at phase 1, which is the 2050 visioning. So we're doing a sort of a wide engagement process with Bothell, with Tacoma, with UW Medicine. We've already done one with our Seattle campus, and we'll have ongoing engagement efforts and different methods of engaging folks to really get that forward-looking vision of what does success look like? What is our North Star? Where are we going? I think it could be problematic just to create a strategic plan for an organization this big without that long-term vision. So that's sort of our immediate focus in the next couple of months. Phase 2 is to then take all of that input that we've gotten from you all, that we've gotten from all of our other visioning sessions and different outlets for folks to give us input, whether that's online or in person. And we want to work with our subject matter experts to break that into topical area buckets, so to speak. So that might be greenhouse gas emissions, purchasing, water conservation. And we'll start breaking that down into goals for the university. So we'll have some 2050 long-term goals, and then we'll break that into targets in 5-year increments so that we can start really developing strategies and actions that can get us to those different milestones. This is going to be an iterative process over the next 18 months. So we're, this isn't sort of a one engagement and done. We're going to have a couple more community meetings where we can get your input on the draft, where the draft plan is at thus far. And we'll also have some more passive engagement opportunities. So you can send letters to the plan. You can be part of our working groups or subject matter expert focus groups. A lot of this is outlined on our website. So I don't want you to think this is your only opportunity to engage. So we're going to have multiple iterations of a draft plan that we will request UW community feedback on. And we'll continue to refine and iterate on the draft plan until we get a final plan that hopefully everybody's pleased with. And we anticipate that to take about 1.5 years. So we are going to use your input, collect your input. We're recording this meeting. We're taking notes. We're going to synthesize all of the information that we get from you. And also really want to make sure that we're thinking about really innovative ideas that might come from this process, as well as some really practical and feasible next steps as we think about sort of making progress in 5-year increments. And then those ideas will be incorporated into the plan, and we'll be asking for your input throughout this 18-month process. So Lauren is going to, when we wrap up, talk a little bit about how we can make sure that you stay engaged with the process and get plugged in if you want to be in one of those subject matter expert focus groups. You don't actually have to be, for many of these, a subject matter expert. However, for things like energy or water conservation, obviously it makes sense for you to have some background and expertise in those. Okay,
Lisa, it looks like we had one question in the chat. If we can address it now, that'd be great. Before we hand it to Juan, how are you engaging communities and tribes as stakeholders? It's a good question.
Yeah, great question. So we have Lawrence, as our project manager for this effort, has created a really extensive list of stakeholders to reach out to. We do have tribes on the list, although we also want to be deliberate and strategic in an appropriate spot to engage them, as opposed to sort of engaging just to engage. So I think when we get a little further into the process and have some specific areas that we can get meaningful input from tribes, depending on the topic, we will do that. We've also noted some more, I'd say, inside our UW community, such as the Intellectual House, such as the Ethnic Cultural Center, and are connecting with those folks to make sure that they're engaged early and often. And they can be as engaged or provide passive engagement. We're trying to make sure that we're reaching out to them early and seeing where they'd like to plug in. So I hope that helps answer your question. Okay. All right. Next up, I think I'm passing it to Juan. Next slide, please. Yeah.
Thank you, Lisa. And I want to really take a moment and just credit you and your team for getting us to this point. Really appreciate the fact that as the University of Washington is looking at its overall strategic goals, that the recognition of UW Medicine's influence on the university and the community is definitely appreciated. So thank you very much. Next slide. And so, sorry, let me introduce myself. My name is Juan Escalante. I'm Assistant Administrator of Essential Services here at Harborview Medical Center. And I co-chair the UW Medicine Environmental Sustainability Committee, along with Louise Simpson, the Associate Vice President of Clinical Integration, and Pam Renna from UW-NC, the Associate Administrator for Facilities and Campus Development. So I will be spending some time to talk a little bit about our program, sustainability program here at UW Medicine. And before I get into it, I recognize that there's people from all different departments, large and small. And I tend to remind myself when I look at UW Medicine to make sure that we're looking at all of our entities. And UW Medicine is got such a broad range and broad reach across the community and the region itself. And this slide here really encompasses how important UW Medicine is to not only Seattle, Washington, but also the WAMU region. And the fact that we have 35,000 employees, over 200,000 ED visits, and we have over $1.3 billion in annual spend, really just goes to show the scale of UW Medicine. Next slide. So when we look at why sustainability is important in healthcare, as an organization, first I think we need to look at what climate change means for healthcare. And over 200 medical journals name climate change as the #1 threat to global public health, especially when you look at vulnerable populations. Some examples include heat stress, which can exacerbate cardiopulmonary disease and death, while also increasing adverse pregnancy and birth outcomes. Wildfire smoke causes respiratory illness and other illnesses. Climate anxiety and other related mental health challenges are growing. And if we reflect back to 2021, where we had that historic heat dome, which was the deadliest weather event in Washington state history, in itself was associated with 441 excess deaths. And as we look towards the future, it's expected that the frequency and severity of climate events is only going to continue to increase. And then furthermore, climate events impact population health and health equity. Unfortunately, the healthcare industry itself is a driver of climate change. In fact, approximately 8.5% of the total US greenhouse gas emissions are generated by the healthcare sector. And that's through all the different avenues of energy use, anesthetic gases, refrigerants, purchased energy, goods, services, pharmaceuticals, food, et cetera. Next slide. So with that, we have a responsibility as an industry to evaluate our impact and make changes to support public health. And while public health is the core for healthcare organizations such as UW Medicine and serves the foundation for sustainability, there are also several other benefits to consider. We can start with finance. There's opportunities for cost savings initiatives, marketing, especially here in the Pacific Northwest. Our patients and our community, they have the expectation that their healthcare providers and that their healthcare organizations are taking steps to reduce our environmental impact. Under talent, increasingly more employees are interested in environmental and social governance. We are seeing a high level of engagement at all levels, from frontline employees, clinicians, nurses, and other operational teams as well. And with operations, we can see improvements in efficiencies and optimize workflows. And finally, for me, the most exciting is innovation, which sustainability really allows the fostering of a culture of collaboration where interdisciplinary teams can come together and really come through and work through some very challenging problems. Next slide. So specifically for UW Medicine, we have 3 foundational goals. The first is to ensure care delivery systems are resilient to climate impacts. Next, that we provide care for patients impacted by climate change. And then finally, that we develop sustainable healthcare operations. Our goals are supported through 7 focus areas that build on the framework of Practice Green Health, which is an independent organization whose mission it is to reduce the environmental footprint of the healthcare industry. Next. So I'd like to share a few of our accomplishments as UW Medicine. First and foremost, we were one of the first health systems to sign the White House Health Sector Climate Pledge back in 2022. Since then, over 1,000 organizations across the country have made a strong commitment to reduce our greenhouse gas emissions across our organization. Last year, we launched a public-facing website that included our UW Medicine commitment statement to help increase the visibility of the work that we do. Thanks to the work of Lisa's team, we were also able to complete a greenhouse gas inventory for scopes 1, 2, and 3. This is the first time that as the university, including UW Medicine, has done a full assessment of all 3 different scopes related to greenhouse gas emissions. And through that inventory, we discovered that UW Medicine accounts for 43% of all greenhouse gas emissions for the University of Washington. So that just, again, signifies how big and how significant UW Medicine is to the university from an impact perspective. Next, the UW MC Center for Behavioral Health and Learning achieved LEED Gold certification. That's a great accomplishment that was recently earned through that project. So that's a building on a Northwest Hospital campus. They were able to demonstrate a 50% reduction of water use, energy reduction of 32%, and 20.7% reduction in embodied carbon for construction materials. So great work to those teams there. And we also participated in the School of Medicine Climate Change and Clinical Practice Symposium that kicked off last year. And I'll share a picture towards the later of the presentation. And finally, we have a few awards at the bottom, across Harborview and UWMC. There's been recognition for our great work around sustainability in reducing waste, and also efforts around sustainability practices. Next slide. Here are a few of the financial benefits of our sustainability programs. Ultimately, we are, as an organization, we do have to generate revenue and income to be able to support our mission. So just wanted to take a moment and connect the opportunities for cost savings and financial improvements for the organization that can then allow us to support our mission and other initiatives that are important to us. Next slide. So now I'm just going to share briefly a few projects that have happened throughout our enterprise. First, starting with the Blue Wrap project. This is something that was kicked off at Harborview back in 2022. Blue Wrap is the wrapping that is used to cover instruments for the operating rooms. And it's a very difficult item to recycle. And essentially, there's very little or no demand for this. Our team here was able to partner with an organization in Oregon to be able to receive this plastic and to repurpose it. Our EVS teams work very closely with our recycling group as well as our OR teams to be able to operationalize the recovery of clean Blue Wrap and get this sent down to Oregon. So it's a really exciting story, and we're able to keep the over 4 tons in the first year of Blue Wrap out of the landfill. Those items were then repurposed to be able to make items for landscaping plants and I believe construction material. Next slide. Another exciting project that really encompasses the system-wide approach or opportunities of UW Medicine is around nitrous oxide reduction. Starting with that graph on the upper hand top right corner, our anesthesiologists at UWMC, specifically the Motley campus, they've been working very diligently to reduce the amount of nitrous oxide that's been administered clinically throughout their organization, which is an excellent step, and you can see how much progress they were able to make. When we looked at our use here at Harborview, we actually found that our clinical use was low, but the amount that we were purchasing was high. So it led us to conclude that our system was wasting 95% of the nitrous oxide gas that we were purchasing. That is not through anyone's fault. It's really kind of it's an old system that we have, and it's prone to leaks. And there's currently a project that's going on at Harborview, led by Gabriela Henkels, that's working with various teams to be able to decommission our central nitrous system here at Harborview. That project is, once completed, will allow us to take our lessons learned and share that with UWMC so that they can evaluate the potential and feasibility of decommissioning the central nitrous systems at the Montlake and Northwest campuses. Next slide. And finally, I'll talk a little bit about our single-use device reprocessing program. This is an excellent program that's been spearheaded by our supply chain team. And essentially, this program kind of falls into the circular economy, which is a closed loop system that allows us to be able to reuse resources. UW Medicine purchases reprocessed SUDs, single-use devices, from Stryker. And those items are then collected. Once used, Stryker then comes to our facilities, picks those items up, and then those items are reprocessed and undergo a rigorous inspection. They are then cleaned, inspected, and then made available for UW Medicine and other hospitals around the country to be able to reuse. Through this program, we have been able to divert over 450,000 pounds of waste from the landfills. And in partnership, they also plant trees for us. Over 869 trees have been planted. And this program, as you can see by the graph above, through this program, we're able to realize significant financial savings, which amounts to over $27 million over the course of this program. And another exciting part of that is that's ongoing savings, as you can see, continues to grow year over year. Next slide. And then finally, I will close with this picture and also a plug for the next symposium on climate change and clinical practice. Here in this image, this is a picture from last year's climate change and clinical practice symposium, where we had participants, people participate in an interactive waste audit that took place at the UWMC campus. This group specifically sorted waste from an open hernia repair and also a robot-assisted hernia repair, compared to see how the different surgical approaches affected the waste that was generated. So this year's symposium will be held on March 6th. Everyone will have access to a copy of the slides, and you can register. Definitely a great opportunity to be able to not only have some great learnings, but also interact with our colleagues across UW Medicine and even beyond that, as there's participation from other people from other hospitals as well. And I believe that's it. Next slide.
Thanks, Juan. Great presentation and just really great examples of some of the big wins that that UW Medicine, Harborview, and all of you folks have been working on. And it's been a real great learning opportunity for myself and my team to learn more about the opportunities in healthcare. So thanks to you and many others on this call and for your partnership. Okay, so just back to our agenda. So we are now going to start working on the actual why we're here today, discussion and brainstorming and getting your ideas for this visioning work and helping to guide our strategic plan. So a little bit about today's approach, both with the individual visioning. I'll start with the individual visioning. We're going to use this what is, what if, and what's next framework. So Lauren's going to bring up a Padlet exercise here in a minute where you're going to get to write down some of your ideas. But essentially, think of this as sort of what is taking stock of how sustainability shows up in your day-to-day currently, And I think that is important to sort of help both us as individuals as well as our team and the consultant team sort of get a baseline of how things are showing up for you in the healthcare system or the university as a whole. Then really starting to think about what if. What are some of the opportunities that you see? What would you like to see in terms of the university's ambition and the healthcare system's ambition? Both short-term and long-term. We talked a little bit about earlier about those 2050 goals. And then what's next? And so after we have go into these individual visioning sessions and breakout groups with you, that will then help us synthesize that information, see what trends and themes are recurring, what sort of really novel and unique ideas come up from you all that could have a really tremendous impact on the university. And that will help us to better structure our working groups and implementation of the plan moving forward. So that's a very simple and high level overview of the approach today. And I am going to, I think, pass it off to Lauren, right, to bring up the first exercise.
Yeah. Thanks, Lisa. So again, this is the first kind of activity we're asking you all to participate in. Please follow, either take a screenshot or a picture of this QR code, or follow the link that will be in the chat. Damon, would you mind plugging that in the chat? It should be in the agenda document if you copy and paste it over. This Padlet, I don't know if anyone's used it in this group before, but it's a really handy tool, again, to collect information from a group via a live kind of virtual community board. So I'm going to take a second and load that up on screen. And thank you, Damon, for putting that in the chat. And we'll get started. I'll walk you through some of those questions. Give me 1 second. Sorry for the wait, folks. All right. Should be seeing my Padlet screen. So I'd like us all to start with the what is number one question here. And so what I'm asking you to do is right under that what is title, there's a plus button. You can also comment, but it's a little easier if you add your own kind of post via this plus sign button. But we're asking, where does sustainability show up in your day-to-day? So we kind of want to get at that. What we want to take stock of what's currently happening, and be able to reflect on those achievements, and also being able to identify what's those activities and initiatives that are currently taking place, what those are. It will help us kind of veer in the direction we want to go, and set the goals and actions to get us even further down the line with sustainability. So I'll let folks think a little bit. And you're welcome to move on to number 2 or 3 as well. But I'll give a few minutes for this number 1 first. And if you're having trouble with the Padlet, feel free to use the chat too. Well, we can bring those over. All right, well, I think we'll move on to the next question. I've seen a lot of great answers to this first column. Always makes me happy and inspired to see what everyone else is committing to and working on. So the second question we have here is, what sustainable practices would you like to see incorporated into your daily routine, and which areas of sustainability are you interested in exploring further? So it could be, what you're passionate about, but also something that you might be able to implement or integrate into your current role. Would love to hear your thoughts on this. I just want to read a few of these since I see folks are kind of getting ahead, so that's great. But a lot of what I'm seeing is kind of waste reduction measures on a lot of fronts. more sustainable procurement opportunities, and kind of how that process works. And if anyone wants to speak to any of their comments, feel free to raise your hand or put in the chat. I saw Janet added a comment in the chat, so thanks, Janet. But yeah, a lot of what I'm seeing is that reduction of waste, low value reduction, incentives for reducing the implementation of low value care, thoughtful choices about academic travel. I definitely know that's a topic of interest for a lot of folks here at UW, is how, when, and how frequently we travel. That's a big one, and I know an important one for many folks working in the medical field. I'll point you to the next two questions, and we can spend some time thinking through those as well. But again, feel free to add to any that we've already covered. This board will stay live for a while, even past today's event. So if you think of something later today or tonight or tomorrow, feel free to come back. So this third what is question is how you're seeing equity and environmental justice show up in UW medicine. So your work, the culture, the kind of guidelines or policies that you all follow. Equity is going to be a crucial piece to this new plan, and one that we are aiming to intertwine into every piece of the plan itself and align with UW's current diversity goals and priorities. And so to do that, it's helpful in these beginning steps to understand where folks are experiencing equity, diversity, and inclusion measures being conducted, or maybe spaces where there could be more of a focus on it. So we wanted to include this question because equity is a key piece of sustainability itself. So welcome you to put down your thoughts for that number 3 column. And then number 4, this is looking into the future. So this is to get your gears turning for our big breakout station exercise next. But we want you to think, in 25 years, what would UW medicine sustainability efforts look like? What would it have achieved, accomplished to help mitigate the risks of climate change and a lot of the impacts that Juan went through earlier? I put some examples of, areas of work or operation that could be changed or be impacted. So think about what you would want UW medicine to look like in 25 years and what kind of sustainability goals, priorities it would have. So I'll turn back the tunes and I'll let you all think for a few more minutes, and then we'll wrap this up and move on to the next section of the agenda. All right, I want to have you all finish your final thought here on this activity. I want to thank everyone who contributed to this board. It's really, really helpful for us to be able to gather this information. And I really like seeing not only the ideas generated, but also the kind of communal thinking on things. I think it's really a helpful tool to use to spark new ideas and just find ways to identify new ways of thinking. So appreciate this. A lot of what I saw and was reading in the kind of what if column here, number 4, about what UW medicine could look like in 2050 was integration of sustainability on all fronts. Have it be a part of every decision, have it be a part of, patient care and the values that UW medicine is committed to implementing and working by. And again, keep adding to this if you have additional comments, and we'll also make sure that the chat is brought over. And we'll be, as Lisa said, documenting all of this and analyzing it further to help inform our kind of overall 2050 vision and also bringing it to those working groups who will help, or who will be writing and writing the goals and actions of the plan itself. So all of this is really great info. I want to bring us back to the PowerPoint to introduce our next activity. And I also want to note that this is a 2-hour meeting, and I want to make sure everyone's taking care of themselves. So if you need to stand up, stretch, take a bio break, please do so whenever you need. I will switch over now, and I think Lisa, I'll hand it over to you in a second for an intro to the breakout sessions.
Yeah, great. Thanks, Lauren. Thanks everyone for taking the time to do that. I think it's also a nice exercise in that everyone's so busy with your daily job, with your families, your lives, that taking a little bit of time to be able to just sit and make space to think about some of this stuff can be really, really helpful. Okay, so then the next part of our meeting, and arguably the most fun from feedback we've gotten from previous participants, and most sort of energizing and rewarding, is we're going to break you out into different virtual breakout groups. And I'll just go through quickly. You're going to go through each of these different topic areas in your breakout group, and you will have a facilitator and a note taker with some prompting questions to help you think about some of these different topic areas. We've really tried to work with Juan and other folks from UW Medicine to tailor these to healthcare. But this is just a starting place for discussion. So if there's something that you think of during these breakout sessions that doesn't fit into any of these categories, don't worry. Please just, we're here to hear your ideas and collect your ideas and your thoughts, et cetera, to help with the plan development. So don't let that stop you. This is just a framework for discussion. So the first one is healthcare operations and infrastructure. So really thinking about food systems, waste, energy use, carbon emissions that could result from a lot of these different systems, commuting, water consumption, sustainable landscaping practices, those kind of things. The second category is healthcare education and research. So really thinking as a large global university, we have the opportunity to sort of scale up and teach and expand through our teaching and making inspiring others, educating others, and many of you are in that role to do that with the healthcare profession. So that's thinking about things like sustainability courses and literacy programs that we could integrate. What do those learning spaces look like? Are they adequate to really teach what you'd like to see students learn? And then obviously research and innovation that focuses on sustainability, as well as living lab opportunities. So we have a lot of operational issues that we could address in our healthcare system and on campus, and a lot of subject matter experts working on innovative ideas. What opportunities do you see to create that living lab scenario? Topic C is the operating room and patient care practices, excuse me. So a few examples: waste segregation, how do we separate medical plastics for recycling or taking to a third-party supplier, fluid management systems, material reuse and equipment, rigid sterilization containers, reformulating surgical kits, reprocessing medical devices, and anesthetic gas. We got a great preview of that from Juan earlier. The next topic is supply chain and procurement, a huge area of opportunity for healthcare. So this is a big one, but embedding sustainability into the processes to reduce impacts both on human health and the environment. And then the last topic area is engaged leadership and governance. So really starting to think about what are some of the needs, what are the things that you would like to see for UW Medicine to scale up and accelerate sustainability when it comes to existing business processes and procedures. I want to do a huge thank you to all of you just for making time for this and making time for the discussion. I hope it was useful. It was definitely useful, and know it will be for our team and the consultant team. Janet, to your comment, this is meant to be and will be the start of more to come, and more partnership and working together to actually implement change. So quick wrap up. Please take our survey in the QR code. We want to continuously make these types of events and discussions better. So we want your honest and sincere feedback. We will be gathering all this information and sharing it on our website. Again, another way to just make sure we're being transparent as we move this plan forward. Lauren's got how you can stay connected with our website. Please reach out with questions using the sustainability plan at uw.edu email. And a huge thanks to Lauren and our whole sustainability team who have been leading the charge here with getting this event and the whole plan process update organized, and our consultants as well. So thank you to UW Medicine. Thanks to all of you again for your time, and please reach out with any questions.
Thank you,
Lisa.
Thank you.